If you are suffering from knee pain due to arthritis, even the simplest everyday activities like climbing stairs, getting out of a car, or even walking can cause severe discomfort. For millions of Americans, arthritic knee pain can severely limit their lifestyle and enjoyment of activities. Your doctor may recommend a number of options to treat your knee pain. Some examples include rest, exercise, weight control, physical therapy, pain medications, non-drug pain relief such as topical arthritis creams, and nutritional supplements. There may be a point when conservative methods of treatment such as these are no longer effective. One of the most effective ways to reduce your pain and restore your mobility is with knee replacement. A recent Arthritis Foundation study shows knee replacement has a 90 to 95% rate of patient satisfaction. In 2006 alone, more than 600,000 primary knee replacement surgeries were performed in the United States. But many other patients who might also benefit from this procedure do not consider this treatment option because of fear, misinformation, or a lack of awareness. The goal of this program is to help you better understand joint replacement surgery, including what to expect before, during, and after surgery. You'll hear from actual patients about their experience with joint replacement and how this surgery has enabled them to have less pain and a more active lifestyle. It may be a surprise to many, but the knee is actually the largest joint in the body. Commonly referred to as a hinge that allows the knee to flex or bend and extend, the knee is much more complex. While hinges can only bend and straighten, the knee has the additional ability to rotate or turn as it bends. Interestingly, a woman's knee joint is able to rotate a bit further than a man's, especially during deep knee-bending activities, the movement needed for kneeling, squatting, or sitting cross-legged. The knee joint is formed by the tibia or shin bone, the femur or thigh bone, and the patella or kneecap. Each bone end is covered with a layer of smooth, shiny cartilage that cushions and protects while allowing near frictionless movement. Cartilage, which contains no nerve endings or blood supply, receives nutrients from the fluid contained within the joint. Arthritis causes joint pain and stiffness. The most common form of arthritis of the knee is degenerative or osteoarthritis, which is usually caused by wear and tear from overuse or trauma to the knee joint. Other problems, such as rheumatoid disease or an injury, may also damage the knee joint. Pain, along with a sensation of grinding and popping, can occur in the knee joint when the cartilage is worn. One bone rubbing directly against the other produces pain. The cause of your pain may not be obvious and may be felt in other joints. Your level of pain is one of the most important indications of the need for treatment. Many factors influence the decision to undergo joint replacement. A key question is how much pain is affecting you and your life, your ability to work, enjoy activities, perform simple movements like climbing stairs, or even sleep. Another question is whether you're getting enough relief from other treatments. The appropriate time for surgery is determined based on the severity of your osteoarthritis, level of pain and immobility, and other factors. It's your knee's condition, not your age, that determines when you need knee replacement. You and your surgeon will decide the best time for surgery.
I was in pain almost all the time. I went to get on a chairlift and I couldn't bend down to get on the chair, so it was an uncomfortable situation and I just was not enjoying life anymore. I was avoiding things that I had a very strong passion for, and so consequently, I knew a decision had to be made to be able to rectify this part of my living.
The real turning point for me making a decision to make a change was when I had my grandchildren last summer and they wanted to go to the park and play, and I overheard them talking. And they said, "We really want to go to the park and play, but we're too little to go by ourselves, and we know it's too far for Grandma to walk. And it was only 2 blocks away.
I really couldn't do a lot of the things I wanted to do without a lot of pain. And since I'd been active all my life, I wasn't a very happy person. It was a gradual thing over a period of years and years, but it just became worse and worse and worse. And finally, in the last year before my knee surgery, I couldn't do anything.
I've been in good shape all my life, from climbing and skiing and doing different things. And so I was beginning to lose my conditioning, and I'm wondering what is happening to me. So I went to the doctor and said, I think I've got a problem. I was standing there, and he said, move your knees a little, and they ground. You could hear them grind and creak, and he said, well, yeah, let's get an x-ray. And so he said, Jim, you wore them out. Those pills aren't going to do any good. He said, you need a couple of good knees.
Early diagnosis and proper treatment of knee arthritis is important for long-term mobility. If your doctor has recommended a knee replacement, it's important to understand that delaying surgery too long may reduce the success of your surgery. There is no cure for arthritis and its degeneration, which means that your pain and limited mobility are likely to get worse over time. Joint replacement can help you resume routine movements of everyday life, such as climbing stairs, tying shoes, and getting up from a chair. It can also allow you to resume work and the activities you love. There are 2 different types of knee replacements your doctor may discuss: partial knee replacement, also called unicompartmental replacement, and total knee replacement. In some cases, knee replacement surgery can be performed using a smaller incision, which is sometimes referred to as minimally invasive surgery. This procedure may allow for less disruption of muscle, tendons, and ligaments, and potentially a quicker recovery. Partial knee replacement is usually considered if only one compartment of your knee is damaged. Instead of replacing the entire joint surface, this procedure repairs the damaged area. Partial knee replacement is usually most appropriate for less active patients within a healthy weight range. Total knee replacement, or arthroplasty, is usually considered when 2 or more compartments of your knee are damaged. This procedure involves complete resurfacing of the end of the bones of the joint with components called implants. There are 3 components used in the knee joint. The femoral or thigh bone component is made of metal and covers the end of the thigh bone. For the tibia or shin bone, the metal forms the base of this component, while the medical-grade plastic called polyethylene is attached to the top of the metal to serve as a cushion and smooth gliding surface. The 3rd component, the patella or kneecap, may be all polyethylene or a combination of metal and polyethylene. The new components are stabilized by your ligaments and muscles just as your natural knee would be. The knee replacement is intended to mirror the complex movements of the original knee joint while reducing pain and restoring mobility.